Yep, also the measles outbreak has gotten the attention of North Texas, and unfortunately it has taken a child's life. So our Mervyn Hurst has more on the importance of getting vaccinated.
Covenant Children's Hospital in Lubbock confirms an unvaccinated school-age child died from complications due to measles. Because of privacy laws, officials cannot give out any other details.
The way that I say this is it's because this is a big deal, and we have known that we've had measles in our community. We are now seeing a very serious consequence of what happens when we have measles in our community.
In a news conference, they talked about the severity and the dramatic rise of other unvaccinated children still in the hospital. The hospital confirms 20 patients, ranging in age from infants to older children. Some have required intensive care treatment. Doctors say the young patients came in with traditional clinical symptoms.
High fever associated with it, and then a constellation of respiratory symptoms, red, watery eyes, significant nasal congestion, and cough are the hallmark symptoms, and then proceeding with a rash.
The West Texas measles death is the first in the country since 2015, and the heartache may just be starting.
We know if you're in a room with someone with active contagious measles, you have about a 90% chance of contracting that illness if you are not immune.
Unless residents follow recommendations to get vaccinated. Fatal cases come from respiratory issues, encephalitis, brain swelling, and neurological issues that could even resurface 7 years later.
I think what we need to know about measles is a very severe illness that has a mortality rate of about 3%. And so knowing that when we have large outbreaks, unfortunately, statistically, there's a significant risk of having a death.
So how young is too young? Well, the CDC says that children between the ages of 12 to 15 months old can get that first of the 2-dose vaccine. You're looking at 4 to 6 years old for that second dose. So if your child is exposed at any age, the physicians tell us today they recommend that you speak to your pediatrician within the next 72 hours.
Important information. Marvin, we thank you.